Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to Back in Action. Coach Josh here with Coach Dusty and Dr. John Lavelle, and today we're talking about first steps. I'm going to be a regular patient that walks into the clinic. Dr. John Lavelle, I'm going to start with you. My lower back hurts. It's been hurting for 6 months. I'm all out of ideas. I don't know what to do. Go.
Well, I think the first thing you want to do is develop a rapport. And I think that's where a lot of physicians, practitioners lose that, is they want to get right to the point because they think they have the answer walking in and get out as quick as possible.
Is this why people feel a little disenfranchised when
100%.
they go? Okay.
And so I think, and it doesn't take long to get to know someone and meet them and be personable. And I think that's the key, developing that relationship so they build that trust, which we've talked a lot about. But that's going to help them feel comfortable and trust what you're telling them and buy into what you want them to do to get better.
This is the therapeutic alliance where the studies will actually show that the pain will decrease by up to, I believe it's like 30% just from having a physician listen to them.
Absolutely. And you'll see it as they leave the room. If you develop that relationship, when they come in miserable, they leave with hope and confidence and feel better already. Yeah, obviously they'll probably still have pain, but they're going to feel more confident about the path. And if you get them that optimism going, as we've talked a lot about in the past podcasts with how the neurological system works from the pain into the brain, it's going to boost their cortisol levels. They're just going to start feeling better. So it's just going to help that journey and get them better quicker.
Now, I know I gave you intentionally a global, just miasma of stuff, but I feel like
But that's what most people come in.
Exactly.
They come in and say, my back hurts. It's
Yeah.
hurt for 6 months, however long. But so developing that rapport is the first thing I'm trying to do.
Are you looking for things? Like, are you looking for, like, when I walked in, are you like automatically like
Absolutely.
sizing them up?
You're looking at their gestalt, how they handle themselves, how they walk down the hall into the room. Do they have a little limp? Are they leaning one way? Are they bent forward?
Do you see if like what they say aligns with things? Like if you're like, oh, this kills me to pick something up, and all of a sudden they set down a 30-pound backpack.
And they're putting their Mountain Dew down on the floor next to them. They can bend.
Yeah.
Or they sit up from the chair when I ask them to, but they tell me they definitely can't do squats at the gym. Mm-hmm. So I'm assessing all those things while trying to talk to them and assess them. But the first simple things are, you just walk in the room, you get to know them a little bit, ask some personal questions. But I do move pretty quickly where I'm asking, how long has this been going on? Mm-hmm. What have you done for it so far? If it's been 6 months, what have you tried to do? Where does it hurt? Is it just in the back? Do you get any pain down the leg? Any other issues going on? Medical history? Have you had a history of cancer, infections, anything like that? Rule out kind of the bad stuff first. And that's just took 30 seconds to do, and you're ruling all that out, but then trying to obviously then assess them. If they're saying it just hurts on the right side of the low back, having them stand up, seeing how they move when they're up, walking, sitting, standing. I'll often have them do lunges or squats or, bend a hinge at the waist.
So you have how they move. Like
absolutely.
Real move. Okay.
Because that's really the end is I tell them, the goal is to get you feeling better and out of pain, but it's really to get you functioning and do the things you want to do.
Yeah.
So I want to assess what they can do now. And then when they tell me what their goal is, what they want to be able to do, that's going to, by knowing what they can do now, movement or mobility wise, that's going to help us on the path to get them to do the things they want to do.
And Dusty, feel free to add in anything that you may think when we're leaving out with this, but like when I hear you go through some of that and you're having them do movements and so forth, and you say we're checking boxes of what may be the most dangerous, obviously loss of bowel and bladder, that's bad.
Yeah.
But what are some, besides, like you said, down the leg?
Yeah, so if they have in that what people call sciatic type pain or radiculopathy, pain shooting down the leg into the foot, is there any neurological deficits with them? Motor function, sensation, loss of reflexes. So ruling that all out. Or if they do have it, it's not usually a medical emergency, but what's causing that loss of function that they're having neurologically? Mm-hmm. Is it coming from that nerve being pinched in the back? So all of that's narrowing down what I think is causing it, and then deciding, do we need to do any imaging, X-ray, MRI, CT scan, or can we just start them on a path that's going to get them better, knowing that based on their history, talking with them, exam, we have a good idea what's going on. We probably don't need an MRI or even an X-ray. Sometimes we can get them on the right path. Or do we want to get imaging because maybe an injection will help? Rarely are you going to jump to anything surgically because rarely is that necessary.
I was going to say, isn't that something to the arena of 1% to 3%?
I would say less than that, but yeah, It's very rare.
Okay. Now, you said imaging. Do you, and maybe this is not the correct way to ask this comes from my amateur status at this, but do we image too much?
Absolutely.
Okay. And a lot of do that because
a lot of docs, they'll image them with an X-ray before they've even seen them. Where I don't like doing that because who knows what X-ray can cause, and it's definitely patient dependent whether they're going to have some long-term deficit. If they, every time you're getting a CT scan or an X-ray, is all that radiation doing harm? It's hard to know for sure. It's probably pretty minimal, but it's definitely a risk. So why expose something to that radiation if it's not necessary?
Are you, and this is maybe a different subject, are you in with the trend of elective MRIs just globally to see what's going on?
No.
Okay.
Because usually it's unnecessary.
Yeah.
I would say 10% of the time the MRI is giving me the answer.
10%?
When it comes to the spine. Usually already based on their history and exam. I use the MRI only if I'm going to do a procedure. So I make sure there's nothing else. Is there a mass? Is there infection? Or there's something I gotta, maybe not do an injection at this level because something's going on there. Also, it helps narrow down because if I do a procedure, I want to be specific where I'm putting it.
Are there other red flags that you see there? Like if you would have said, instead of saying 6 months, I would have said 2 years. Does that make it less severe,
not
more severe? Does it change anything?
It depends on, again, their history. If it's someone that's had back pain for 2 years, but they've just been taking ibuprofen or Tylenol, haven't done anything for it, that's not surprising. And they've been less and less active. It doesn't raise my suspicion. But if they've had a history of prostate cancer and they're having right hip pain, do they have metastasis of those cancer cells to the bone? Or if they've had a recent, hospitalization, they had septic shock with bacterial infection in their blood, has it seeded into the low back causing a spinal infection? Yeah. Those are the things I'm looking for. So that's where the history comes in, knowing what brought them in. Did they have anything before that could have been going on to be any of those things I have to be more nervous about?
I thought talking about this would be really good for the athletes and the patients that we have that are not, that can't meet with us, that aren't using our online programming, that have asked us, what do I do if I'm not there? So I thought this would be good. Based on what you're saying, it doesn't, let's check all those boxes. It doesn't seem like anything is today critical. What would you say to me? I went in, my right low back hurts. It seems to be non-specific. Would we dial into, hey man, do you know the day, the moment that it started hurting?
Yeah, so I'll often ask, when did this happen? What caused it? Was there any inciting incident? Did you have a trauma? Did you have a fall? Were you lifting something, or did you just wake up one morning?
Most days you really don't know.
Usually, and again, that's a small percentage, 4 or 5% of the time, is there a trauma that causes the injury? Usually it's just wear and tear in the background of the spine. As we get older, we're developing arthritic chains, or our muscles are getting deconditioned and weaker. So eventually you reach that tipping point or that threshold where the pain starts to fire. And that's usually the cause. So people will say, well, all of a sudden I woke up and had back pain. Well, usually you've told me nothing caused it. So we know we can then, if we do have imaging,
right?
Absolutely.
That's great. Yeah.
It usually means that it's just, average wear and tear, age-related degeneration in there. And we can get it better because everyone has that, but most people don't have persistent pain. So what haven't you been doing, or what have you been doing that's wrong that we can adjust to get you moving better?
Are there some things that you see that are just normally? Like, and I hate to fearmonger people into sitting, but are there things that you're like, oh man, this one is always there within people that have pain?
It's almost always less activity.
Just overall less activity.
Yeah, they're less mobile. They're getting older. They're less active. They're sitting down more. They're not working anymore. So it's more of a sedentary lifestyle.
Okay.
And we see that with people working too. A lot of it's
overuse,
digitalized age. Everyone's sitting down. We're not doing as much, manual labor.
Yeah.
But even those that are, sometimes you're doing manual labor, but it's repetitive on a conveyor belt. You're always twisting and rotating the same way. So it's that repetitive overuse, but you're not. So they think they're being active if they have a more physical job, but it's that repetition where over and above that, they're not training the rest of their body or their trunk to stabilize it.
Yeah, so somebody who's active, but just doing everything is to the same side.
Yeah.
Okay. Gotcha.
Could you just say like golfers?
Yeah.
Yeah, absolutely.
Well, you see that too, postal workers.
Yeah, that's right. Sunburn on one side. Yeah, that's right. Okay.
I see that all the
there's a
time
lot
in their necks with postal workers. They're always
Police officers too.
Oh, the hips.
Yep.
Yeah, the hips from wearing the duty belt all the time. That's right. Oh, that's good. That's another topic we can get into right there. Now, so look, we've checked all those boxes. Nothing seems to be crazy wrong. What do you do? So I'm going to leave you, but we're not going to do a procedure. You're clearly not failing me by not doing a procedure, but what do you tell me to do?
So the first thing is assess what they've been doing, but then often it's sending them to Dusty, sending them to you, or sending them to physical therapy to assess which muscles aren't firing appropriately, what's being overused, overtrained, and to balance things out, basically. But getting them mobile and getting them stronger, functionally stronger. So they
Dusty,
can do the thing.
That's the thing. We got it through. Let's say that part didn't happen. Like just as a hypothetical. Let's say I came to you, man, my right low back has been killing me. It's been 6 months, whatever it is. What is the first step that you would take? But let's assume that we have not had the conversation with Dr. Lavelle. They just came to you because a buddy said you're great.
Well, it's very similar to his.
Okay.
I think the rapport is really the important piece in the beginning. Because, your buddy might have worked with me or worked with you and had a good experience, but I don't know what's going on with you. I don't know how long it's been going on, but I start to assess the same things that he would. It's like I'll see them walk in. I hear them just tell me what's going on, what they are doing or what they aren't doing. And you can normally get a pretty good, just understanding of kind of a global situation. Yeah. And I would say, the vast majority of the time, it's lifestyle, related. It's either they're inactive and doing nothing, or it's the pendulum swings to the other side where it's like overactivity or overuse.
In one specific format often.
And that's really like the two camps that, people land in. It's either too much or too little. Very rarely do you have that person that comes in who, they're regularly in the gym, they're active, and, they're having this persistent pain that's been, ongoing for some time. So
usually when it's someone that's like that's been good, your perfect patient doing everything they should be, usually that's when it's been a traumatic incident.
They know exactly when it happened.
Yeah, it happened doing that deadlift
they can tell you.
or whatever it
right.
was, But sorry, go ahead.
Well, I think then you go right to the movement piece.
So I come to you that first time. This is a sight unseen. I was referred to you, whatever it is. What are some of the movements that you would tell me to do right here and now that I could use to diagnose myself, maybe at home if I'm watching this from afar?
Well, the very first one, especially like in the situation you explained where it's low back pain.
And the reason that I use that one is because it seems to me over decades of doing this that when people talk about something like a knee, it's very far removed. It's like, ouch, my knee hurts. But they're okay mentally, whereas when it's the low back or the neck, people are like, I'm really pissed off because my back hurts. It's a very different thing.
So I typically do what they don't want to do, and that's hinge at the hip.
So you push it, you poke the bear a little bit.
Yeah, I have them do that because it normally will tell you a lot. Just having them do a body, weight hinge at the hip. Just show me, what does your hinge pattern look like?
And you're not asking them to do something that they're not doing in life because more than likely they're hinging thousands of times.
Typically I will demo it,
Sure.
I'll show them exactly what I want, but then allow them to just, hey, you move the way that your body wants to move or the way that you think you need to move. And then that's where you can really start to understand, okay, I can see there's a deficiency here.
So if we're describing this to somebody at home who doesn't have access to us and is not using our online programming, you say to hinge. So that means I'm going to keep my knees relatively stiff, maybe a little bit of a bend. I'm going to push my hips way back, maybe towards a wall behind me.
Yeah, and that's always a good
limitation am I looking for? Let's say that I have my hands down to my sides. If I start to feel restricted when my hands get to my knees, is that a sign? Do my hands need to make it to my toes? What am I looking for?
Well, I think it varies person to person, but that's one of the things that you would have them do is start to hinge. And then it could be, hey, I want you to hinge until you feel pain.
And pain or restriction?
Either.
Okay.
It could be pain or restriction.
Got it.
And then have them describe, like if it's pain, describe that to me.
Yeah.
I mean, are we talking like excruciating, knife pin pain, or are we talking about, you just feel, you feel something different?
It's tight.
And let's start to define and work through, some of these things that you've kind of formulated in your brain. They may be right, they may be wrong, and that's where you can start to kind of break down some maybe just misconceptions. I would say a lot of times that's really what you're dealing with is they had some pain. They didn't even realize that they started, moving differently, favoring, the low back or the hamstring or whatever it might be. And so that feels better than the alternative. And so they just continue to do that. And then as time has went on, that's fired up other areas.
This is the person that I drop my pin on the ground, and instead of the normative, I bend over, it's more like I squat down in some
we're not talking about, somebody not, keeping their back active or anything like that. I mean, we're talking about somebody who it is really not using their hip.
Right. That's right.
And so that is a huge, red flag for us, because that's just a movement pattern, deficiency and issue. And we can address that.
Would you say that that's what you see more often than not?
Yeah.
Now, if that's the case, if I'm the athlete at home, and as I start to move in the hinge, I feel restricted, I feel pain. Well, where do I start that athlete at? How many days a week do I start them into some sort of fitness? Let's assume that they've not been doing much of anything.
Yeah.
And then what are some of the exercises that I would start with to be able to rebuild that?
Well, first we're going to work with what you have available. So if it's right now, you can hinge to the top of your knee, and that's pain free, and everything's good, and you're feeling good with it, then that's a brick I'm gonna stack. I'm gonna use that one, and I'm gonna be like, all right, we're gonna use that today. That's what we're working with. We're going to just work to build some confidence in that movement pattern. I might have you hold some weight. I might not. We may be holding nothing.
Depends on the person.
Could be holding a PVC pipe, a broom, whatever.
Let me stop you there, and I want to ask what Dr. Lavelle says is pain. I'm always curious to see. I know what you and I are willing to do.
Yeah.
I want to know what you're willing to say is okay from a clinician's perspective. You're gonna be uncomfortable.
And pain's so variable for people, but I always say mild to moderate.
Does mild to moderate mean if I'm doing the exercise and it, for lack of a better term, it flares, that's okay as long as it diminishes? Or is there a level that you're willing to maintain for a day?
It's kind of both. So I say if someone's not working with someone and they're at the gym doing a movement, I say if it's painful during the movement, maybe something's off and back down from that movement.
Okay.
If it's sore after the fact, I'm not as concerned.
Got it. Okay.
Or if it is a little uncomfortable during the movement, is it tolerable? Can you finish the movement with your normal form? I'm not as nervous about it.
Okay.
And then like Dusty was saying with the hinging, that gives me so much information. So if it's when they're bending forward and hinging, if they're having pain, as they're getting to their end range of motion, I'm thinking, is it more disc pain, irritating a nerve in the back? Or if it's more when they're returning to the upright posture or leaning back, is it more the arthritis in the joints in the back? Obviously, it can also be muscular too when they're bending forward, especially when they're doing this position. A lot of times it's tight hamstrings, tight paraspinals, tight hip flexors can often play a role. So just those simple movements gives you so much information.
Avoidance is probably the biggest hurdle, because avoidance is normally fear-driven.
Sure.
And then as you desensitize that, the fear is increasing. So you don't get more comfortable. It's not like today you won't hinge at the hip, but if you rest 2 weeks, in 2 weeks you're going to come back and be like, I'm good. So it actually normally goes the opposite way, is like if you just rest, now you come back to me, nothing's changed.
That's right.
We're in the same position. Whereas if today we can get 2 to 3 inches, if that's all that we really can work with, what we're doing is there's a desensitization that's going on.
Right.
And so there's this shift that starts to happen mentally, where now something that they didn't think they could do, they're now doing, maybe not to the full scope of where it should be, but we've flipped and we're moving in a direction. We've got a goal. We're working toward, maybe it is the top of the knee. Maybe it's below the knee.
Perfect world. How often do I do that?
Every day.
Every day.
Yeah.
Even if I'm not with you, if I train with you, you'd say maybe 3 days a week sounds good?
Yes.
So, but if I'm at home, I could do this every day. Okay.
Well, you're already doing it.
Right.
That's the thing, like he said, you say you can't squat, but you just sat in the chair.
Sure.
Or you can't hinge, but you just picked up your
Maybe you
purse
could do
off
it
the ground.
better.
Exactly.
Yeah.
So you're already doing the thing that you think you can't do. It's just now, it's just reframing it.
Yeah.
There's just this misconception that's taken place, and now we just got to educate and build confidence. And you can watch it. I mean, you see it in their face.
Yeah.
When somebody does, like, the hinge is the biggest one, because I don't think they just don't understand what the hip joint and what it's actually capable of, because it's like, this person can't, maybe this is all I got. This, at this point, you feel like I can't do any more. But then I lay you on your back and I position you for a glute bridge. And now all of a sudden, I'm dropping you down into this position. I've just changed your body.
Mm-hmm.
Okay, I've taken you from a standing position. Now I've laid you flat on your back. Neurologically, you're not thinking about all these different variables. You're not thinking about the bracing. Am I doing it correctly? Because my back is now flat on the ground.
Right.
So they've been protective.
Sure.
Now I get them in a safe position.
That's right.
And they let their guard down. They don't even know they let their guard down.
Yeah.
Then you explain to them, wow, you just hinged like this far on your back. Let's see if we can now just bring you to your feet. Same movement. We're just going to activate these abdominal muscles a little bit. That's what's going to kind of help us lock everything into position.
You're unconsciously proving to the system that they can do the thing they didn't think they could do.
And I think that's really, our job.
Yeah. When do I know to progress? Like you said, okay, cool. So I've been doing the thing that you said, and is it just I get more range of motion? Do I have to be out of pain? Like, when do I progress to the next stage, and what would the next stage be?
Well, I feel like, and a lot of times we don't even have to dictate that. They do it naturally.
Do it, yeah.
It's like, as you start to move, I would say, it's on a regular basis that I have a patient come in who doesn't think that they can hinge at all. I mean, they're doing the squat to pick, things up from the ground. We start with just some, hinges just against the wall, no weight. We're just kind of talking through positioning. Where are you feeling it? Is the hamstrings engaged? You feel it in the glutes. And as you start to do that, it naturally, even in just one set, if I have you do 10 hinges to mid thigh, and then maybe we go and we do something totally different. It could be that we just walk down the turf. We come back, you clear your head. We're talking about work, whatever. And I say, hey, we're going to do 10 more. Now, all of a sudden, I didn't say hinge lower, but this time around, they're hinging to the knee or below the knee. I would say 99% of the time that happens.
Yeah.
And guess what? I don't say a word.
Would you say that comes from them just kind of letting their guard down through time?
Yes, and confidence. It's like
Confidence
the
is the key.
the rapport's been built.
Yeah.
They trust me now because I listened. I didn't say, that's not true, you can do this.
Right.
I just said, okay, let's work with what we got.
Yeah.
I validated it, really was sensitive to the situation.
Yeah.
And then kind of changed the subject a little bit, to where we just kind of go, let's clear our head. We talk about the gym, whatever, and then we come back to it. And now all of a sudden, what was a huge issue in the beginning, the elephant in the room, is no longer even a conversation, And so by the third set, we may be holding 20-pound dumbbells, and they don't even realize it.
Yeah.
And then
that's
it's
the huge key is progression. It's like you just said, by the third set, not the third month.
right.
And that's what people get stuck in so often is they're not progressing. So they went to a therapist, and I say therapist because it's not you guys, because you guys do progress them, but there's so many people that will try to get them to hinge, and they'll just baby them and string them along, but they're not learning how to progress on their own. So they're just told these 10 exercises, but then you come back, now you're not with a therapist because he showed you those 10 exercises and he's got 10 other patients in the room. But you're just doing those same routine every visit you go, shelling out $50 for your copay, but no progression.
And we all know if you do the same things you've always done, you're going to get the same things you've always got.
That's correct.
And so it's like, if today this is good, but next time it's going to look a little different. We're gonna switch some things up. Maybe it's that we're going to introduce some new movement patterns. Maybe we're going to be to increase the weight. There's a lot of different angles that you can take on how you progress.
Well, without linear progression, there's no adaptation. That's why everything you put on it would be like a Band-Aid. Like, sure, it might feel better here and now, and then while you walk away 1 hour later, you're like, this hurts.
And our goal is not to hang on to you.
Right.
That's not our goal.
Right.
So,
but it is that you keep exercising.
100%. Yeah. This is not a fix and you go off.
That's right.
We've now exposed something that this is what you got to do. Yeah. And this never goes away.
You don't get to bank strength and then just keep it.
What I love about it is I love reassuring that with the patients, because they'll come in and say, I worked with Dusty for 2 months. Best I've felt in 20 years. Let's say they're 55 years old. But then the holidays came around. I haven't been doing as much over the past month and a half. My back started hurting. That's why that's why I'm in the office seeing you. And I say, well, that's why you're in the office seeing me, because you stopped doing the thing, the movement, the exercise that got you better. So now you know that this is a lifelong thing. It's not a go for 2 months and you're cured. Yeah. The cure is maintaining consistency with the exercise routine.
Here's another thing I think that sometimes people think, because I hear this a little bit, more online than I do in person.
That's what we do, right?
I don't want to be muscular. I don't want to be, I'm not trying to get, super fit or anything like that. Well, that's great, because that's not what we do. Right. If that's your goal, obviously we can help you do that. But
that's a very specific thing.
This is about your lifestyle. Mm-hmm. This is about you being able to live and function like a normal human being should, that you're not just accepting age and writing it off as like, I'm just getting old. There are going to be things that definitely, you as you age, they're going to be unavoidable. We're all dying. Spoiler alert. But you don't have to die scared and sitting in a this just paralyzed situation where you can't go for the walk, you can't ride the bike, or in your mind you think you can't go to the gym. You can do all those things. You just have to be willing to do hard things. That's really what it comes down to, in just accepting the fact that this is something, and whether you're doing it or you're not, or you think I'm a genetic freak and I don't have to, you're wrong. We all have to do this thing. It's just maintenance. You cannot jump in your car, put oil in it, and drive it for 200,000 miles and think that it's all going to be okay. You're either going to run out of oil, or you're going to, lock up your engine, or you're going to have other things that go wrong with your car that, were unexpected. Well, the human body is built very similar, So it's like, there are general things through your nutrition, through your movement, through your mindset. That's the one I feel like that your mind is like, that's really what's stopping folks. It's not necessarily their back. It's just in their mind. They've self-diagnosed or got on the internet
by other clinicians too.
And it's, because here's the thing. If I can scare you, I can control you. Mm-hmm. Yeah. That's just the thing. That's right. So, the goal is
media work.
And that's the opposite of how we approach it. Right. Is like, hey, I'm going to help you break down these barriers, these lies, basically, that you've kind of told yourself, or maybe been told, and help you to believe that you can do these things, that your body was created to do these things. And so that's where you just unlock, I feel like, something that people, they don't realize how much control they actually have over their health. I think they're just reliant too much on the internet. And even, I think most doctors do a good job, but I think a lot of it sometimes is fear driven.
As coaches, I think our biggest job today, and it wasn't this 20 years ago, I think, and I would say that yours maybe too, and correct me if I'm wrong, it's just a filter of bad information. There's so much information, and there's even a filter of really good information that's not really necessary right now. Well, you don't need all of these things. Here's where you need to put the focus at. And I think that's where it goes
back to like, he does a really good job of setting the stage for us.
That's right.
You know,
Oh, yeah.
he makes our job easier when they come in.
Oh, sure.
But we make his job easier when they go back.
That's right.
So it's kind of, and that's what we need more of. We need more partnerships of people working together, because it's like, that's how we can really make a difference. That's how we can impact more lives. And I don't know about you. I do know that. I mean, that's what
we like to do.
We want to just have impact on people's lives,
right.
you know, in a positive way. And so I think that's really what it comes down to. And it's more just about educating people that you can.
Well, real quick. So we've given a really good proscriptive model of how it works. Like here's A to B and what we would do in terms of exercises, in terms of even poking the bear. We're not afraid of the thing. We're going to actually try to do the thing. Let's say that I've gotten to where I feel pretty good, and we've hovered around this. What does that maintenance look like? Do I have to do 5 days a week to get better, and then do 5 days a week for forever, or does it change? What does my maintenance look like generally? Yeah.
So if you came to me with back pain, I mean, obviously that's going to be what we tackle first,
sure.
You know, there's no timeline on that. It looks different for everybody.
That's right.
It could be 2 weeks, it could be 2 months, it could be 2 years, but my goal is to quickly move away from us just focusing on your back as quickly as possible. Once we're trending in a good direction, we're going to keep, programming and implementing in things to strengthen the back and to improve it. But we're going to start to move. I mean, we understand that this is a unit,
but I can look to dedicate 3 hours or 5 hours to fitness each week.
Man,
I
think 3 days. I mean, you're talking about 3 hours every week.
Okay.
To me, everybody can do that. And if you can't, then you got a time management issue, and you probably need to address that. It's not that you can't work out. It's just, you got to really figure out if that's something you want to do or not. In my opinion, you don't have an option. So you can either choose to keep doing what you've been doing, and we'll see you in a month.
If you really want to get out of pain, they'll do it.
That's
right.
And
so that's what happens.
But if you want to stay out of pain, you'll keep doing it.
But you get 100%. In this routine, it's like, hey, it becomes just like you eat, sleep, you work. There are things that are built into your daily, weekly routine. You just added one more thing, but it's 3 days a week, and you don't compromise on it. I mean, if you truly want that, then we're going to attack this, the whole body.
Yeah.
And we're going to create a program that does just that.
I think with most athletes, I do think that it does become a thing. They do like it. They do want to do it. But there are outliers who are like, do I really need to keep doing this to feel good? And I think that needs to be expressed. Like, yes.
That's what's most fulfilling for us, I think, for me for sure, but also for the patients, is when you send them in and they start training with you guys for their back starts feeling better, but then all of a sudden they realize, I'm in the best shape I've ever been. I've never felt healthier. I haven't felt as good in literally 20 years.
Yeah.
That reassures them that they're on the right path.
That's right.
But it's also reassures us that, we know what the hell we're talking about.
Yeah,
this actually does make a difference, not in their back, but in their life. They're better husbands, better wives, they're better with their kids. Everything changes.
Man, pain wreaks havoc on the way you deal with the world. So like if 100%. You are in pain, you are not a happy husband. You are just not happy at anything. And I get that. I totally understand it. And that's where we come in at. We can hopefully refute that piece. And then, like you said, create a whole nother, what is it? You only go to like 3 places. There's home and work. And then maybe the gym is one of the other ones.
And the thing is, when we're talking about all this, we're not just saying, go exercise, you're going to be fine with your back. It's not that simple, but it is a huge piece of the pie. There may be other things, injections, medications that they have to do to supplement this, but all of that is so they can get moving. And that's the key is, surgery, injections, medications, acupuncture, chiropractic, that's not the cure. Almost never is that the cure. That's to quiet down the system or to put it in the right physiological state so you can start moving.
Well, nutrition. And it's all about allowing them to like, hey, if that's what you want to do and you feel like that's helping you move the needle, by all means, go do it. I mean, that they're all available and they've all worked for somebody. So, I mean, we can help. We can help give suggestions. We can help give guidance. But at the end of the day, like you got to figure out what works for you, But I think you nailed it when, you said the 3 things that you do. Say them again.
Yeah, you go work, you go home, and then your third is probably the gym, some sort of fitness.
I
And
think
it becomes that over time.
I think that's just like you build everything else around. Those are your pillars.
Because
you know,
they make you feel good.
they do.
Hopefully you're doing a good job at all
And
three
if you can land those, then you can kind of backfill, you know,
That's right.
these other gaps. And when you do that, you're going to see improvement.
Gentlemen, that's all I got.
That was good.
Thank
Good
you
to
for
be
your
back.
time.
Yeah, good.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.